initial consultations are different. So if a patient converts on the telephone and books straight in to see the dentist for an exam, the TCO will see them first. So let's just imagine a scenario where the dentist currently offers a 30-minute new patient examination. The TCO will see them first of all for 20 minutes. So there's less time needed because in this 20 minutes, all they're going to focus on is building rapport and asking the emotionally based questions. So this is what I like to call the pre-clinical interview, and this is what a lot of dentists are doing. Rather than getting the patient straight in the chair, they're trying to build a bit of a relationship, get a bit of history, but the way the TCO does it is so different. You know, they'll spend around 8 minutes just asking the emotionally based questions. As I said, they're all open-ended. It's just getting the patient to talk. The patients feel so cared for. They really do. And when I was a TCO, I used to ask patients why they had left their last practice. And 9 out of 10 would tell me that they weren't listened to. So suddenly they're in a practice where they're being listened to. It's great. They absolutely love it. It saves the dentist so much time as well, because this is the level that you should be doing your preclinical interview, dentists, but you don't have to now because the TCO is going to do the majority of it for you. So once the TCO has done their consultation, they'll go and check the dentist is ready and do a handover. The handover has 2 parts. The first one is with the dentist and their nurse, and it's a very factual based conversation, I'd say. So this is the patient's personality profile, these are their concerns. They may talk clinically, their concerns are the upper 2 to 2, they've got a massive overbite, the whole upper left quadrant's missing. They might speak clinically then to the dentist and nurse. That's absolutely fine. And they'll let the dentist know the obstacles as well. So it really is going to be money that this comes down to for this patient. So all the things they've identified, they'll tell the dentist and the nurse. Go and get the patient, take the patient in to meet the dentist, introduce the dentist, introduce the nurse, which is always very important, I must say, and then they'll hand over again, but this time they'll do it in an emotional way. So they'll say, Junior's coming to see us today because she's really concerned about the appearance of her upper front 4 teeth. For many years now, they've been chipping and breaking. She has a huge crack up the front of one of them, and she's so self-conscious she puts her hand over her mouth all the time when she's talking to people. So you carry on the conversation in that way. Obviously, I'm just making something up now, but if I was with a real patient, I'd really get that emotion going. And then you leave the patient with the dentist to have their examination. Before you do that, let me just take a step backwards, sorry. Once I've handed over and done the emotional handover, the last thing I will do is just drop in some kind of social information. So I would say, so June's here to see you today to find out what the options are to help her resolve the issues with her smile and her confidence. Oh, and by the way, yourself and June live in the same area, or you and June both play golf, or you and June both have 2 children the same age. Whatever connection I've made between the patient and the dentist, I'm going to give that connection across. So that will really help the dentist because I don't have to do the small talk. It should only be the TCOs doing small talk. This allows the dentist to go straight in with really strong relationship building topics rather than, oh, did you travel far today? And all this stuff. They can go straight in with, oh, wow, so do you have boys or girls? What's your handicap? What's this? What's that? They can go straight in with all of these things, and it's much, much nicer. So moving on to treatment planning, there's 2 ways that treatment planning can occur. Either on the day with the patient there and then, so the patient just needs a crown and a hygiene appointment, or quite often dentists need time to sit down and treatment plan all the options because they're either running late, it's a complex case, there's lots going on. I applaud dentists that love to do that, okay, that want to take time out to treatment plan. I love it. And what I don't like is when treatment plans go out in the post or the patient's sent to the desk to wait 5 to 10 minutes to get it. That's not very respectful to the patient or to the people on the desk because trust me, they don't take a seat and relax, they're hovering around you. So they're the 2 items with treatment planning, and the same with options. So do you give the options on the day or do you give the options at a later date? So if you do need to take time to treatment plan, what I recommend you say to the patient is this. Now, today I've taken lots of records, and there are quite a few things going on in your mouth, which is fine, that's not a problem. But the great news is there's quite a few options available to you to solve these problems. But what I need to do is take some time out of my diary to sit down and plan all the options out for you. So I'd like to bring you back for a complimentary appointment next week where we can sit down together and go through all the problems, all the solutions, and the fees associated. How does that sound? Your patients will just be like, oh, wow, that's so different. They'll love it. They'll see the value in what you're doing for them. So if you do need to take time to treatment plan, don't send the patient out to the desk to wait. Don't send them something in the post. Bring them back. That's really important. In between the examination and bringing the patient back, really that shouldn't be any more than 7 days later, by the way. I'd aim for 5. But in between the exam and what I like to call an options meeting, the TCO and the dentist need to meet, because the TCO really helps the dentist. Again, this is reducing their non-clinical time, essentially increasing their hourly rate. They'll find out what all the treatment options are, get those onto the computer. They'll get all the estimates and consents ready. They'll create a PowerPoint with all the photographs that you've taken. And then all you have to do as a dentist is just sign everything off to say that it's correct. So it saves you loads of time, especially with these big cases. So, that really, really helps such a lot with patients and, non-clinical time with dentists as well. When the patient comes back to have the options presented to them, the TCO and the dentist are together with the patient. So they're all booked in at the same time. The dentist will go through all the problems, all the solutions, the alternatives treatment plans, the risks associated, the fees, giving the patients constant opportunity to ask questions, which is so important for valid consent, and then leaving the patient with the TCO where the TCO can wrap it all up. But when the dentist leaves the patient with the TCO, the dentist is now back in their room treating a patient, yes, doing dentistry, which is great. And the TCO stays with the patient, and the first thing they'll always ask them is, do you have any questions for me? And it doesn't matter how great your dentists are, the patient will always have questions for the TCO because they feel embarrassed to ask the dentist. And one day I'm going to write a book about questions I've been asked, because that would be quite funny. But it really is fantastic. And because the TCO has already met the patient, either in a free consultation or on the day of the exam, they have that relationship with the patient, and the patients will ask them questions. And you get to find out their true objections, which is so important. We just try and work it out in our minds, are we psychic? But the patient will actually tell the treatment coordinator what they're really thinking. And that is just fantastic because it helps you so much in practice. It really does. Now, if I just go back a couple of slides, this initial consultation process where the TCO sees the patient first, takes them in to see the dentist, and then if it's simple, is obviously seeing them at the end. That system works exactly the same for private or NHS patients. So it doesn't matter whether you're private or NHS, that's the same system that you can use. I will say a lot of NHS practices struggle to do initial consultations on new patients purely for time factors, but that system can be used on NHS as well. So further responsibilities that the TCO has, as I just said, overcoming patients' objections. They need to have really strong verbal skills to be able to do that. They're also responsible for following up with patients, new patients and existing patients. Isn't it typical that when you're running late, a patient comes in and let's say 3 years you've been talking to her about replacing missing teeth, and finally today when you're running late, that patient says to you, I'd really like to talk to you about replacing those missing teeth now. It is just typical. That's what happens. So this is where you can use the TCO role, because you can say to the patient, okay, great, not a problem at all. Go and speak to Laura today. She can go through all of that with you and you can have a nice cup of coffee at the same time. The other responsibility that TCOs have is with existing patients. They need to go through all the patients that are coming in and having a look at, basically, do they have outstanding treatment? Can we talk to them about membership? Do we need to give them smile questionnaires? They can go through and identify patients that need different things, because all patients need different things. It's not right to give every single patient a smile questionnaire every time they come into the practice. Patients don't like that. If you have a treatment coordinator, they can identify the patients. Again, if maybe you're doing an NHS conversion or suddenly introduce membership and you want to get more patients onto your membership, the TCO can be blocking time out of their diary in advance to make sure they're there to talk to your patients at the end of their recall examinations. The other key thing with TCO role in your practice as well is the internal marketing. So with internal marketing, it's just so important. Again, as a TCO, so many patients used to say to me that their dentist didn't offer the treatment that they had come to us for. I know those practices offered those treatments. The patient just didn't know about it. So again, the TCO can be having a look through all the patients that are coming in and looking at which areas they might not know about. You might have had a patient in your practice, they've been coming for 10 years and you've introduced three new types of treatments. Do they actually know about this? So you can actually identify those people and start to internally market to these patients, making sure they're aware of all the treatments you offer, because obviously they can recommend their friends and family as well. So that's really important for existing patients.